Hi everyone, it's Dr. Nonnie here. I hope you're all doing very, very well and enjoying summer. Summer is always a great time in Saskatoon. We don't get much of it, do we? So it's really lovely to be here and with you all. And I hope you're also catching up with the Summer Off the Sofa series, which I'm doing because I'm really working on managing obesity this summer with my patients. And I want you all to also get to a healthy weight. And so I have someone here who is to help us. So when we try to do all those exercises and we get any injuries, we need help. And that will be my guest today. So before I introduce her, I'm just going to take a moment to say a very big thank you to all those who have been subscribing to my channel. I really appreciate you. It's just, I'm so grateful, is all I can say. And if you haven't subscribed, I don't know what you're waiting for. You're getting health and lifestyle at a fingertip. And all you have to do is press the subscription button and it's free for you. So now to my guest. So Melissa is very, very special to me. This is Melissa Plumb. She's my first, well, I think I've had a Canadian guest before, so she's not my first Canadian guest, but she's a very special guest. She's helped me a lot personally. And so I've asked her to please take time off from her very busy schedule to join me today. So please welcome Melissa Plumb.
Hi, everybody.
I'm just going to read Melissa's bio for us. So Melissa is a physiotherapist. She's also an acupuncturist. I didn't know that about you, Melissa. I think you must have told me, but it skipped my head. So she graduated from the University of Saskatchewan, but a Bachelor of Science in Physical Therapy in 2006. And since 20, I think it was 20, wait, it says that you became certified in 2015 and you've worked in clinics since 2006. So basically what Melissa does is, because her bio is very, very long, it's going to summarize. She's a physiotherapist. She does acupuncture, and she's also a clinic manager of Mackie Physiotherapy. They have various sites, but she's mostly in the Evergreen one, which is where I go and see her as well. She has a strong interest in orthopedics and acupuncture, and she's dedicated to assessing movement dysfunction, muscle imbalances, and utilizes her manual skills and acupuncture to restore biomechanical movement and improve her clients' symptoms. Melissa believes it's important to educate clients on their condition and how to maintain and make further gains on their own at home with exercises, postural, positional changes, and modifications to daily activity, which she really does do that. So I know she does. She continues to take post-education courses to increase her knowledge and clinical skills. And the courses she's done include myofascial release courses, orthopedic level system courses, and acupuncture, amidst many others. Her special interest, even though she's a whole body physio, she particularly has interest in shoulders and hips, and she's increasing and expanding her knowledge of treatment in these areas. Outside of the clinic, Melissa is a sporty mom. She's a hockey mom, so she loves to go to the rinks with her children and spend time outdoors. And she's recommended places for me to visit when I was new to Saskatchewan, and I took her up on those recommendations. My family also enjoyed that as well. And so, Melissa, I want to say thank you so much for joining me today.
Thank you for having me.
Yes. So, as I said earlier in the introduction, Melissa is a physiotherapist and she's treated me. So, some of you may know that I had this really bad accident where there's this HGV crushed my my vehicle, my SUV, and it was the worst accident for 25 years in the UK. And I wasn't even meant to survive that accident. But thank God I did. But I had some injuries to my knee and actually I couldn't even walk for some time. So when I began to walk and recuperated to an extent and I moved to Canada, I was still in a lot of pain. So my GP recommended me to see Melissa. And Melissa really worked with me and helped me with the treatment. And I was now able to go back and jog again, which is something I really thought I wouldn't be ever able to do. Because my physio in UK said to me, I don't even know how you're walking. So the goal was just maybe to keep me walking. But with Melissa, she was really a hands-on physio, which is not something we find in the UK. The UK just see you and tell you do this, do that. So I really have to applaud her for that because she really worked on me and got me straightened up and gave me exercises. And so I've asked her today to talk to us about knee pain. So Melissa, the floor is yours. I've spoken enough.
So knee pain is something we see very commonly in our clinic. We see it from people who have had trauma to their knees, like yourself in an accident, or people who have had sporting injuries or falls. So often those might be ligaments or meniscus, which is like the cartilage that's a cushion, or your muscles strains and sprains or tears. And then we also see it just with people that have day-to-day pain with just their normal activities, such as running or jogging, walking, or just even the work that they do. And that might be like a patellofemoral pain syndrome or an IT band friction syndrome or a bursitis or other muscle joint problems. And then, of course, commonly we see those that have the normal aging process and arthritis. So with physio, we like when people come to see us with their symptoms, especially early when they've developed their symptoms or have had an injury, because we can do a proper, thorough assessment to determine the cause of your knee pain. So we'll actually test those ligaments, test the meniscus. How do your muscles move? What's your range of motion? What's your strength? How does your kneecap move? How do the joints move? And when we talk about knee pain specifically, people will think, okay, we're just going to assess the structures around your knee, but we're actually going to look at the low back, hip, and pelvis and how they move, and even the ankle, because the knee is the middle guy. So what happens above or below the knee can actually impact or cause your knee pain. So as an example, if your glute muscles that move your hips are really weak, it changes the forces at your knees, and then now you can develop knee pain. So once we've done our thorough assessment, we can educate you on exactly what's going on. We will give you a diagnosis, and then we move on to treatment. So with treatment, like she said, lots of hands-on treatment, muscle release, mobilize those joints that are stiff, stretch the muscles that are tight, educate you on activities you might need to avoid or how to modify those activities, different postures to use, how to change your work positions, maybe braces to be worn, but most importantly, on top of the hands-on treatment is you understanding what's going on so that you can help yourself at home through some home exercises, like stretches, strengthening, stability. So that's kind of the main thing you'll get from coming to see a physio like myself in a private orthopedic clinic. So
Yeah,
knee
thank you.
pain.
Yeah,
Sorry,
sorry.
go
Oh,
ahead.
go on. No, that's fine. I thought you had taken a break there. I was going to ask you to tell us more about how to even get to see you guys. So keep going.
Oh, yeah. So to come see us, if you're coming to a private orthopedic clinic, so say you were coming to us specifically at Mackie Physiotherapy Evergreen, we have a website that you can go to. You do not necessarily need a doctor's referral in order to come to see us unless you're using insurance benefits that require that referral first. But most of them allow you where you could even just come to a physiotherapist before you see your doctor. And then we can even direct you back to the doctor if we feel some diagnostics might be appropriate, or we need their assistance with some of the pain management if you were unable to see your family physician first. So you can go to our website, you can book online with us there, or you can contact our clinic specifically if you're coming to see one of us. And that would be at, I'll give you our phone number, 306-952-6277.
Yeah, so with I'm glad you said that because obviously, in the UK, because my audience is both UK, Canadian, and Nigerian as well. So with Nigeria, they have a lot of things that are privately sourced. So if you needed a physio, it wouldn't be a problem if you wanted to go and see one. But with the UK, most things need to go through a GP first. And though now they have these physios that work in the clinic where you're supposed you could see the physio first. So with you guys, it's easy to just come and see you. And I think that's the point I want to make because I'm trying to get people to be active, to lose weight, to get your BMI normal. That's one of the videos I just did a few weeks ago. And one of the things you said is when you're doing all the exercise, sometimes you do get sporting injuries. And people should know that they can just go to a physiotherapist. The doctor doesn't have the wealth of knowledge for everything, especially because we know that in Canada it's so hard to see a family physician. So you could go to someone like Melissa or her colleagues and then pitch up there. And then they're quite good at when they've assessed, either writing us or sending a note through the patient saying you need to have an x-ray or ultrasound or something like that. And so when you come to us, or even the walking clinic, which I'm going to be doing walking from 1 today, we will be able to assist you with that and send you to get those investigations done. So just going back to knee pain, I mean, how common is knee pain compared to, say, back pain and other things? I mean, with physio, what's your bread and butter?
Well, obviously, I'd say shoulders and back pain are probably the most
Mhm.
common, but knees are very commonly seen too. So they're not as common as low back pain and shoulders or neck pain, but definitely, especially in the younger population, we're going to see a lot more sporting injuries. But then in the older, just to elaborate on what you're saying about working with patients with weight loss and getting more active, it's not just with physiotherapy treating pain and dysfunction, it's also prevention and maintenance. So we see
Mm.
lots of people who go, oh, I'd like to lose some weight, so I'm going to start exercising, but they've never really exercised a lot in their lives. They don't really know exactly where to start, or they start
Mm.
and then they become injured. So it's actually
Mm.
a good thing from a preventative standpoint that people come see a physiotherapist just to see how are you overall moving? What's your range of
Mm.
motion? What's tight? What's weak? And we can kind of guide you in the direction of what's going to be appropriate exercise for you, maybe not appropriate, or how to give you a few exercises or even a treatment or two to help prevent those injuries. Because if you get injured while you're trying to reach your goals, say of weight loss or becoming more healthy, now you've got this setback. So if we can help you try to prevent it, not to say we can prevent everything, of course, trauma can happen, etc. But at least we would actually rather people come see us like a dentist. You go to the dentist all the time for a checkup, come see us and we can help you with how your body is overall moving and functioning.
That's interesting. I didn't really see it that way because we only think of the physio, but from our point of view as family physicians for treatment. But actually,
Mhm.
I think what you said is quite good because I had a patient who took up my advice and said that she was going to work out and went to the gym, fell over the treadmill, and now it's all gone to pots. She's
Yeah.
getting better and it's taking 6 weeks now to recover, right? So she's had that setback. So I think it's actually quite good. So I'm going to let you now tell us what you've given us some advice of prevention. We know that we can come to you for treatment. Is there anything else that you always think when you see patients, I wish I could just have an opportunity to tell people this? So this is now your chance. Speak.
The main things that physios, other than the prevention stuff that I've talked about, is one thing we see all the time is everyone leaves their aches and pains too long. So come
Mm.
see us sooner than later. As soon as you've had your injury or I've started to feel this pain. If you go for a walk, since we're talking about knees, and you're like, oh, there's a little pinch in my knee today when I'm walking, and you
Mm.
notice it the next time, don't just let that pinch get worse and worse. That's the time to come see physio, because we often see people who think, oh, it will just get better on its own. But in fact, what actually happens is it gets worse, or now they've got hip pain and knee pain, or ankle pain and
Mm.
knee pain because they're compensating and changing how they're functioning. So the take home we always say as physiotherapists is think prevention and maintenance. Come to us sooner. Don't let it go longer. I've had way too many clients say, I wish I would have came to you sooner.
Mm.
And we can really help progress your movement and function and hopefully reach your goals. Obviously, we can't promise anything, but we can definitely try our hardest to help you out.
Well, you've heard it from the horse's mouth. Not that Melly says a horse, obviously, but it's just a saying. So basically, come early. Like most things in health, if you pick it up early, even with cancer as well, with the family physicians or your specialists, something can usually be done. Obviously, we're not going to be able to treat everything, but it's better if you come earlier rather than later. So Melissa is busy and I'm going back into clinic as well. So we just want to just take our time to just give you this health talk. You do well to listen, to share with your friends and your family, because who doesn't need this advice? Prevention, being active, where to go when you're in trouble, when you need help. And so I'm going to leave Melissa's details to her clinic in the bio, in the description, so that you can all reach her, because she's really good at what she does. I don't say that lightly, and she hears me say that all the time. So that's why I had to have her on, so everyone can benefit from her. And I'm sure there are other physios out there as well. Thank you so much, Melissa. I really appreciate your time, and I hope you enjoy the rest of your day.
Thank you for having me. Have a good day yourself.
Thank
Bye.
you.
Bye.
That I've gotta make a change. I don't care if I break, at least I'll be feeling something. Just okay, it's not enough. Help me